Hello friend, today we'll discuss about fever. That is a common disease in our daily life, and that may be signs and symptom of the other disease and disorder. So there is a fever means fever is an elevation of body temperature. The body temperature increase due to the pyrogen. So pyrogen is one protein. That protein disturb our hypothalamus. Hypothalamus main function is there, that is to regulate our body temperature. So that pyrogen protein interfere the our thermostatic mechanism that is controlled by hypothalamus. So if your body temperature exit body set temperature is there, that is 37 to 39 degrees Celsius. So if more than that, that time we should consider that is a fever. Fever means elevation of body temperature. Elevation of body temperature because of pyrogen. Pyrogen one protein. That protein interfere our thermostatic mechanism of thalamus. So thalamus main function is to control our body temperature. If pyrogen interfere, that time our body temperature increased. If we go with cause of, what are the causes of fever? That is neurogenic factor like injury of hypothalamus, that also cause, because hypothalamus main function to control our body temperature. If there is a disturbance is there, that time our body temperature is going to increase. And number two, as an undesired side effect of therapeutic drug. Some drug also there. Suppose if we consider metformin is causes of anorexic condition, means metformin is cause of anorexic condition. So some drug also there, that is therapeutic use is there, but the drug causes of hyperthermia, means increase our body temperature. And excessive exercise, number three, that also cause of body temperature, increase body temperature, and hot environment. And some infectious disease, if you consider that is COVID-19, that is one kind of infectious disease, and that also causes of elevation of body temperature, that is nothing but fever. And number two, inflammation. Sometimes inflammation also cause of increase our body temperature more than normal. And severe is hemorrhagic condition also. Fever may be, and one more important thing, that is number 7 point, fever may be sign of fever may be sign and symptoms of disease and disorder. There I have used 2 points, that is disease and disorder. Disease mainly happen due to the uh, antigen. Antigen means outside any pathogen, that is disease. And disorder, when our body, when our normal function is going to disturbance, that causes of disorder. And disease mainly happen due to the pathogenic in foreign pathogenic particle, or means foreign pathogen. That pathogen, I am using word pathogen because in that pathogen there will come under virus, bacteria, fungal, protozoa. So all of them will come and it under a pathogen. And fever may be due to the vaccination, cause of, due to the vaccination also fever. And overheating of body and dehydration also cause of fever. And rheumatoid arthritis. And certain medication have already therapeutic drugs is there. Some therapeutic drug also side effect of increased body temperature. And cancer also causes of increase of body temperature, elevation of body temperature. And number, some autoimmune disease like SLE, so that also cause of increase of body temperature. And drug abuse also cause of body temperature, increase of body temperature. And alcohol withdrawal syndrome also causes of body temperature. Some viral infection also there, flu, cold, that also cause of body temperature. And sinus inflammation in sinus, that is sinusitis. Chicken pox also causes of increase the elevation of body temperature. And malaria, that is the cause of due to the mosquito. So in that case, our body temperature is going to increase. And pneumonia, accumulation of fluid here in lungs, so that also cause of increased body temperature. UTI means urinary tract infection. That infection cause of elevation of body temperature. Gastroenteritis, inflammation of gastrointestine, so that is called a gastroenteritis. And skin infection also cause of body temperature. And some sexual transmitted disease, STD, also cause of body temperature. And next thing, that is, what are the grades of fever? So low grade fever, when your body temperature in between 37.1 to 38.2 degrees Celsius, that time you should consider that is a low grade fever. And high grade fever, when your body temperature in between 38.2 to 40.5 degrees Celsius, that time you should consider that is a high grade fever. And pyroxia means, this pyroxia, the words came from pyroxene. So pyroxene, I have already told, that is one protein. That protein interfere our thermostatic mechanism. That result, that outcome cause of fever. When and that hyperpyroxia we should consider when our body temperature more than 40.4 degrees Celsius. So that is the cause of hyperpyroxia. And if you see the signs and symptoms of the fever, means signs and symptoms nothing but clinical features, means how can you identify? So there is a one symptoms is there, that is signs and symptoms, that is flushed face, hot dry skin. Anorexia means loss of appetite for food. Headache will be nausea and vomiting. Nausea is the cause and vomiting is the result. There is an important point, that is a nausea. Nausea is cause of vomiting. And constipation also there, due to decrease the intestinal movement, that is cause of constipation. And diarrhea also cause sign of symptom, means cause sign and symptom of fever. And increased heart rate and respiratory rate cause also fever. And shivering also cause of fever. That is the symptoms. And if you go with the treatment in the fever, mainly we have used paracetamol, that is dolo or crocin, 650 milligram. That is nothing but paracetamol. So in the paracetamol, that is a property is there. Paracetamol is anti-analgesic, antipyretic, and anti-inflammatory. Less anti-inflammatory and more analgesic and antipyretic. Antipyretic means it decreases our body temperature by killing the pyrogen, and it has a analgesic property. It decreases our pain. So that is called analgesia. And you can use nimesulide, that is nice, 100 milligram also you can use. And patient should be uh, complete bed rest till fever subside. And if you go with the choice of injection, we have a injection neomol, and 2 cc you can intramuscular you can use. In the diagram there we can see that. And injection Voveron you can use 3 cc intramuscular. And one more important thing, that is you should notice in that box, if you see, check that. So you can check there is a paracetamol or NSAIDs, mainly paracetamol, that is a analgesic, antipyretic, and low anti-inflammatory action. So it has a severe liver damage. It can cause severe liver damage. That is nothing but hepatotoxic drug. So we should limit the use. We should use the limitation of the drug because it causes of hepatotoxic. And one more thing, if you see that is a any bacterial infection is there, that if you suspect the patient is bacterial infection, so you can give some antibacterial medication also. So these are the treatment for the fever. And all the diagram in beside is there, that is a vial for a neomol. So you can check that. That is the intramuscular. There is the intramuscular, they are giving him 3 intramuscular, and there is a warning is there, that is paracetamol is hepatotoxic. So use you should control the dose of the drug. That is too much important. That is our today's topic of discussion. Next time we'll meet with another videos and the new videos. So thanks for watching these videos. Thank you.